starting with that, what should parents be doing with their children? Because the parents, they're lost causes a lot of times. But let's start with children. What should they be doing differently than what their dentist is probably telling them to do?
Well, starting at the beginning, you have to understand that the bacteria that cause both gum disease, disease of the soft tissue, and decay are communicable diseases, and they're transferred from the parents generally to their children unknowingly. And so the first thing is parents need to understand it's transmittable, it's communicable, and if they have any untreated, leaky, contaminated teeth in their mouth, the first time they turn their back, the 3 or the 4-year-old will pick up their toothbrush and mimic them, and boom, it's in the family. When I was in the Air Force in Japan, and we saw new recruits, 20% of them had 80% of the disease. 20% of them had no disease, and the 60 in the middle were somewhere in between. But what we found was the 20% that had no disease, they came from a farm out in Iowa, and no one in the family had any dental disease, and people are all the time saying that they have soft teeth, or their mother had soft teeth, or when they're pregnant, their teeth went down. No, it's just, it's a timeline from the time that first toothbrush goes in their mouth, times the amount, and not the amount so much of sugar, but the frequency with which sugar was ingested. So you can take a whole bowl of sugar and eat it at one time. It's not very good for your blood glucose, but it will cause, in 90 seconds, 10 minutes of acid production that damages teeth. Now, if you take a teaspoon of sugar and you cut it in 10 parts, and you take 1 part every 10 minutes, you will get 10 times the amount of decay. And so baby bottle caries is the worst thing that can happen to small children. And that's when the child runs the show. And if you give them mother's milk, that's fine. If you give them water, that's fine. If you give them juice or sugar, they will scream until you give them more juice and sugar, and you can totally destroy somebody's teeth. So baby bottle caries is something that you want to avoid, and you want to understand that nothing comes in a bottle except mother's milk, formula, and water. And no water for the first 6 months. Water is toxic to newborns. So just heard that 4 days ago when I have a 4-year-old, 4-day-old 6th grandson today. So if the dogs bark or you hear crying, we know what it is. And I apologize, I forgot to turn off my phone. You don't need that on, do you?
So, okay, the juice, that always made sense to me. And even back when I knew nothing and I had my babies, I never gave them juice in a bottle. It was always milk. It was bad formula, and it was other things that I regret giving them. But okay, so as they're growing up, is there anything preventative they could be doing to their teeth to prevent any tooth decay? Because as much as a parent wants to control everything that a child's putting into their mouth or their immune system and how strong it is, we want to protect it from all angles if we can.
Okay, well, 2 things would prevent 98, 99% of all future bacterial disease. That's what decay is. That's what gum disease is. They're bacterial diseases. And those 2 things are, right now, typically, child gets sent to bed when the parents get to stay up, and it's brush your teeth and go to bed. You're being punished. The adults get to stay up. If you flip that and go, if you behave and get ready for bed, we'll brush our teeth together and we'll read a book. Okay, you've changed the entire bonding, and you've tied it to not only learning how to read early, but learning how to clean your teeth. And so now you get a little stool, and you get their little toothbrush and your little toothbrush, and they brush their teeth and you brush your teeth, and then they check your teeth with your toothbrush, and then you check their teeth with their toothbrush. And if you know, the parent has to know how to do this. And it's not hard. You can teach a 3-year-old how to do this. But most children learn how to brush their teeth by themselves when they're 3 or 4 years old. And that neural pattern gets established for the whole rest of their life. They brush their teeth like they're a 3-year-old. Doesn't matter how old they are. So that's number one, is education through learning how to control the bacteria on the outsides of the teeth. And you have to do that once every 24-hour cycle. You don't have to brush your teeth 4 times a day. If you get all the areas clean, the pencil line, the shoreline, the gum line, the gasket clean on the tooth, just that knowledge would prevent 90% of all future dental disease. All right, that's number one. Number two is all posterior teeth in all humans have holes and cracks in them, developmental holes and cracks. They're predictable. Everyone has them. And those holes and cracks go right through the castle wall, right through the thick, hard structure, the enamel of the tooth, right into the inside of the tooth, the hostess Twinkie, or the 24-hour buffet, as I call it. And if you're a bug and you get a gig down one of those things, you can have relatives in that hole for the next 80 years. And every time you take the toothbrush out of your mouth, those bugs go, toothbrush is gone, and they repopulate the mouth. So if you intervene with restorative dentistry, and this was considered very aggressive when I started it, and that's part of the reason why I was so focused on photography, is I knew if somebody saw what I was doing, another dentist, that they would want my license revoked and have me hanged, okay? Because it was such a heresy to go into a tooth that didn't have a hole big enough that the patient could stick their tongue in it. Right. Well, that's like waiting for a house to fall into a sinkhole. And so if you open these teeth up under high magnification with micro burrs, you can almost do this without any anesthetic. But right when you take out the final decay that's left in the inside at the hostess Twinkie buffet level, children can feel that sometimes. And so we do a sealant on 7-year-olds that doesn't take any anesthetic. You just lop it on. It doesn't work very well for more than 3 to 5 years, but it gets them from age 7 to age 14 with minimal decay. Then when their permanent teeth come in, from age 12 to 16, 18, we open up all of these holes and cracks and bond them all shut. It's the most cost-effective dentistry in 55 years. It beats everything because it stops between $50,000 and $100,000 worth of future dental care on that person over the lifetime. All right. And if they don't live as long because they don't have good dental health, it doesn't cost them as much, but they don't live as long. Okay. And so if you do the education part early, and it's real simple, you have to know. Every hygienist knows how to do this. Every periodontist knows how to do this. Every dentist should be instructing this, but there's no billing codes for it, and so nobody does it.
Right.
And so the education part, very important. The filling the cracks and the holes that serve as the reservoirs that reseed the mouth with disease. Every time you take the toothbrush out of your mouth, no matter how good a job you do, you do those two things. You know, I have 3 children, a total of 118 years they've had their teeth in their mouths, not their ages, but cumulative number of years they've had teeth in their mouths. 84 teeth, 1 filling.
Wow.
And I've been doing this for 45 years now, and I've done it to literally tens of thousands of children and adults. And I'm now seeing the grandchildren of the original parents whose children I treated, and then I'm treating now the grandchildren because they haven't had any dental disease. Now, it's a really bad model for a practicing dentist because you're eliminating your work, but I don't really care about that. There's more than enough work. If we eliminated all future dental disease and made all the best decisions for our patients, there would be enough dentistry for the children that are just born to be dentists the whole rest of their life. Okay, but it would save, just the U.S. It would save, $200 or $300 billion a year.
Well, no one wants to hear you because they don't. The dentists want their business. So,
there are many things that the dentist can do that are more in the patient's best interest than what they do. And now we're going back to integrative healthcare, integrative medicine, integrative dentistry. The whole goal here is the very best dentistry is no dentistry at all.
Right.
It's preventing the need for dentistry. And if we can move into those areas, our patients are healthier systemically. They're healthier. They don't just live longer. You can show that when somebody is getting the very highest quality of dental care, they live 1 to 2 decades longer, just looking at their gums and their teeth.